Atopic dermatitis, often sort of synonymously referred to as eczema, even though a lot of people think eczema can be other things than atopic dermatitis. Most patients and lay people think of it as the same disease. Just sort of think of it as your skin is just too sensitive to the everyday things in the world that most normal people can tolerate without any problem. For example, when the air gets really dry, a lot of patients that have atopic dermatitis will start to break out, their skin will get itchy, they start scratching, then they get more of a rash. And in fact, a lot of people have actually referred to atopic dermatitis as the itch that rashes. People itch first and they start scratching, their skin gets irritated, they get this red oozing, and then they end up getting secondary bacterial infections with staph and other things like that that really makes it get much worse. If someone's got atopic dermatitis or eczema, for example, they need to be treated with something to prevent it from getting worse. And some of the things we use are things like moisturizers and emollients. We want to try to, if there's any secondary bacterial infections, driving condition, we want to get rid of those by using antibacterial washes. Bleach washes are very good for that, and we now have the clean body wash that works very well because that can be used both in the bath as well as in the shower. You'll also need to use antibiotics, sometimes hopefully topical, but in some cases it may have to be oral antibiotics. And then even other ancillary things we use are ultraviolet light treatments, antihistamines, topical anti-itch preparations, even in some cases anti-rejection drugs like cyclosporin have to be used in really bad cases. Most cases do begin in childhood, but there are some cases, rarely, that actually begin in adulthood. The good news about atopic dermatitis is that if you develop as a child, there's a fair chance that as you get into your teenage years and a little bit older that you'll outgrow it. You may still have a tendency to have some allergies and hay fever and that sort of thing throughout your life, but in a lot of cases the atopic dermatitis gets much better in the teenage years and in the 20s. It's also not contagious. It's not something you can spread the disease from one person to another. Now, one of the problems is, though, if a child is contaminated and carrying staph, that can be spread within households. It's very important that if a child is infected that they're taken care of and you try to limit that so that the parents don't get it or the other siblings don't get it, because that can be a problem.